You're welcome to NSA 306 Basic Medical and Surgical Nursing Study Section 1. We'll be starting with the introduction to medical and surgical nursing. Nursing is a profession that serves the needs of society in the area of health. The practice of nursing addresses a range of health problems, both actual and potential, requiring of its practitioners a specialized body of knowledge and skills to meet clients' needs and a value system that recognizes the client as an autonomous human being with rights. As a profession, nursing has served a vital role within the healthcare system through history. The rapid changes in health, technological advances, knowledge explosion, demographic changes, and advanced medical science demands that nurses be educationally prepared to provide or plan care across the continuum of setting, from hospital or clinic to human or community, and during all phases of illness. The course you are about to study will introduce you to the overview of the concept of medical and surgical nursing. When you will have studied this section, you should be able to explain the concept of medical and surgical nursing. You should be able to define some basic terminologies in medical and surgical nursing, and you should be able to differentiate between acute and chronic illness. Let's start with the concept of medical and surgical nursing. Medical and surgical nursing is the foundation of all nursing practice. Before now, all nurses practices the art and science of nursing, or on the wards. Everyone was either a medical or a surgical nurses. Medical and surgical nurses are the largest group of practicing professionals. It is one of the most demanding nursing specialties. They make assessments and administer care, treatment, medication, and documentation. Today, many nurses choose to work in the specialty of medical and surgical nursing, settings where medical surgical nurses are needed. Medical and surgical nurses care for patients in many settings, such as inpatient care units, clinics, HMOs, ambulatory care units, home health care, long-term care, skilled nursing homes, urgent care centers, surgical centers, teaching hospitals, universities, and so on and so forth. Let's see the definitions of terms. Homeostasis. It is a key concept in understanding how our body works. It means keeping things constant and comes from two Greek words, homo meaning similar and stasis, and stasis meaning stable. Health, according to WHO, is the state of complete physical, social, and mental well-being, and not merely the absence of disease or infirmity. Health assessment. A health assessment is a plan of care that identifies the specific needs of a person and how those needs will be addressed by the healthcare system of skilled nursing facilities. Health assessment is the evaluation of the health status by performing a physical examination after taking a health history. It is done by detecting diseases early in people that look well in sight, but right within them they have so many underlying diseases. Then we have a chronic illness. It means the illness is long term. It's insidious. A chronic illness can be stressful and may change the way a person lives and how they relate to others. Then acute illness. It means a disease with an abrupt onset and usually with a short course. Then we have infection. Infection is the invasion of the body tissues of a host organisms by disease-causing agents, their multiplication and the toxin they produced. Infectious diseases is also known as transmissible diseases or communicable diseases. Comprises clinically evidence of illness, that is characteristics, medical signs and symptoms of disease resulting from the infection, presence and growth of pathogenic biological agents in an individual host organism. An electrolyte. An electrolyte is a substance that ionizes when dissolved in suitable ionizing solvent such as water. This includes most soluble salts, acids and bases. Some gases such as hydrogen chloride under condition of high temperature or low pressure can also function as electrolytes. Electrolyte solution can also result from the dissolution of some biological and synthetic polymers. Then we have the nursing process. Nursing process is a modified scientific method that uses clinical judgment to strike a balance of epistemology between personal interpretation and research evidence, in which critical thinking may play a part to categorize the cleansed issues and cause of action. Then we have cancer. Cancer is a class of diseases characterized by out of control cell growth. There are over 100 different types of cancer, and each is classified by the type of cell that is initially affected. Cancer harms the body when damaged cells divide uncontrollably to form lumps or masses of tissue called tumors, except in the case of leukemia, where cancer prohibits normal blood function by abnormal cell division in the bloodstream. Different types, between acute and chronic illness. As you can see on the slide, we have acute illness and chronic illness. Let's classify them, differentiate them by appearance of symptoms. In acute illness, it is rapid, while chronic, it is gradual. In terms of duration is short in acute illness, while it is indefinite in chronic illness. In terms of diagnosis, it is commonly accurate in acute illness, while diagnosis is uncommon in chronic illness. In terms of nature of pain, the pain starts suddenly as a reaction to an injury or something else in acute illness, while in chronic illness, it develops gradually out of habitual diet, posture, and so on and so forth. Then in terms of frequency, it is more common in acute illness. Acute illness is more common, while chronic illness is less common. Thank you for listening. See you in the next class. Hope you read more in your course material to understand this course better.